Hi, viewers. Happy New Year. Welcome to 2024. I think this year is starting in somehow an interesting way, but uh, different strokes for different folks. But for us in Ebonyi State, I think there were some things in the health sector to be happy about. At least for now, the pronouncements by the Ebonyi State Governor Francis Ogbonnaya Nwifuru when some persons paid him Christmas homage. Many of you may have seen that video or the circulating reports, where he says nine key things I could pick out from his speech. And let me try to summarize them. Number one, he said the president has agreed to demerge the Federal University Teaching Hospital in Abakaliki. That's the Alex Ekweme Federal University Teaching Hospital. You may recall that when Professor Onyebuchichukwu was the Minister of Health, the then Ebonyi State University Teaching Hospital and the Federal Medical Center Abakaliki were merged to become FETA, Federal Teaching Hospital. Later, it became Alex Ekweme Federal University Teaching Hospital. So right now, Alex Ekweme University is training medical students. Ebonyi State University is training medical students, and they are both using the one teaching hospital. So maybe, like the governor said, he's made case for the merging so that the state will have its own teaching hospital for Ebonyi State University students. He also said that the president agreed to approved that the federal government will support the Ebonyi state government with 100 consultants. That's number two. I will run through them before I make my comments on each of them. And number three, he said by 1st of June, every general hospital will have 5 consultants and 3 medical officers. Interesting. And number four, that's 11.2 billion naira worth of medical equipment, is being procured for the general hospitals, and this should be available, at least by the middle of the year. Then number five, that's the Ebonyi State government is going to establish 4 specialist hospitals, according to him, at least one per senatorial zone. The governor said each of the hospitals in each zone we have at least 2 MRI. These are radio imaging machines, a CT scan, and 2 big other machines. I don't know what the name is, but I think I heard big other machines. Then number six, that's 11 kVA generators has been procured for these 4 new specialist hospitals that is going to be established. Seven, that 52 ambulances have been procured, 20 of which are already supplied, according to the governor. He said that the one they recovered are obsolete, not so good. So you have 20 new ones on ground, 52 ordered, 20 on ground. So we're expecting 32. Number eight, the governor announced that 36 new medical officers have been hired. I think they started that around July or thereabouts 2023. And that's in addition to 4 or 5 that were available, before he came in. For those of you who were doubting when I said Ebonyi State just had 6 medical doctors under his employment, you cannot agree with me. The new governor has confirmed it. Some people were calling for my head when I was saying that. Then number nine, that every medical officer will have a brand new Jeep, that's SUV, and they're already parked in the governor's lodge. And according to the governor, he said that the staff will be happy, the management will be happy, and our hospitals will work. Congratulations, Mr. Governor, and welcome to the Make Our Hospital Work family. The Make Our Hospital Work campaign has been there, and we've spoken many times, we've advocated many times in Ebonyi State for the hiring of healthcare workers, for the equipment of the hospitals, and for our general hospitals to work. And the governor also said we are getting ready to do something very exceptional in the health sector. These are quite very good to hear. And I must commend the governor for taking these steps and the plans and the pronouncements. Why pronouncement is good is at least we have something to hold him to. He's taken some steps, which included hiring of healthcare workers. He's announced some other steps he's taking, and he's also made a number of commitments, which are good. Hearing that from the policymaker and having it on video, not just having press secretary to issue press statements. So having said that, it makes me feel good coming to 2024 because Make Our Hospital Work is one of the three cardinal areas I listed that I'm going to doing a lot this year. I listed brain health equity. I listed health workers issues or matters, and also listed Make Our Hospital Work. Of course, workers matters is part of the Make Our Hospital Work, but I'll pay special attention to that because we have a major crisis in our hands in the country. So now, responding to this, the Ebonyi State team of the Make Our Hospital Work campaign had already issued statements. Damian Omog, the state team lead, did that. They asked a number of questions and all of that. So what I'm saying now is personal opinion. As a professional and as an Ebonyi person who is concerned and who has been advocating for our hospitals to work for everybody, everywhere in Nigeria, but beginning from Ebonyi State or any other state that is taking health very seriously. So the margin of AE footer to Ebonyi State to ensure that Ebonyi State University Teaching Hospital, I think is a good idea. The governor campaigned. I think the only promise he made in the health sector during the campaign was the establishment of a new teaching hospital for Ebonyi State University. So that was the only campaign promise I heard he made on health. So it's good that he's following it through. The State University deserves to have a teaching hospital, especially the fact that the footer, AE footer, will be serving for the Federal University at Ikwo. You also have the David Omain Federal University of Health Sciences that has its own teaching hospital. So with that, we have three universities in Ebonyi that are training medical doctors, and each of them having their teaching hospital. So if it's what the governor decides to do, well, I have nothing against that. But if they could, if UTA can handle medical students from both sides, also nothing bad with that. But the governor has already made that pronouncement, and hopefully he follows that through. But also need to look at why was it merged in the first place? Why were the two merged in the first place? The State University Hospital was having a lot of issues. They were always going on strike. I remember when I started my house job in 2008, November. By April 2009, we went on strike that lasted 3 months. And while the strike was on, I got another house job in Abuja and I moved. So Ebonyi State government must put measures in place to ensure that the issues that led to the margin in the first place are addressed by having a sustainable way of, making the workers there not feel inferior in terms of payment and other welfare to those who are working in the federal establishment. That's very important. Then number two, the 100 consultants that the governor said Mr. President promised to make available to Ebonyi State. As good as it sounds, I'm just wondering where would the federal government bring the 100 consultants from? Do you know how long it takes to train a consultant? A medical consultant, after you've done medical school, you've graduated, you are a doctor, you do your husbandship, you do your youth service. To become a consultant, you need not less than, say, 5 years of specialist training, postgraduate specialist training, depending on the area of specialty. Some might take 6 years, 7 years, 8 years, as the case may be. So, and this is Japa season. Health workers are leaving, including consultants, are leaving the country. So even federal government doesn't have the luxury of having enough consultants in their teaching hospitals. So where would they manufacture them from? Well, if we get up to 100 consultants, That's good. Perhaps they will be more useful at the teaching hospital that the state university teaching hospital that is being restored. Governor Nwifuru also said that by 1st June, every general hospital will have 5 consultants and 3 medical officers. 5 consultants and 3 medical officers. I'm just wondering what would they be doing in the general hospital? We don't need 5 consultants in the general hospital, at least not for now. Let the consultants work at the teaching hospital, the state university teaching hospital, whether they are coming from the federal government or whether the state is hiring. The good thing about health is with the right pay and the right incentive, you get people. Just as our people, they japa go elsewhere, others go japa come Niger, come do the work as long as they are sure that the work condition is good. It's not just about what you're paying them as salaries. It's about the work environment, that everything they need to work is there and the health workers are well motivated to do their job. So if you put that in place, some might, do reverse japa if it's if it's so good and come back, or even people from other countries will now migrate to Nigeria to take up the jobs if our people are not taking it. So 11.2 billion naira for equipment, well, is good. The devil, they usually say, is in the details. So at the moment, I don't know the details of the equipment. I just hope the procurement is based on need and not just, for the sake of it. But it's good to know that we're spending that amount to procure medical equipment. While it's being procured, I also hope they will hire people who know how to use this equipment. There should also be a planned preventive maintenance for this equipment. So within Ebonyi State, we should have biomedical engineers who have the capacity to fix this equipment should any of them have problem, so that we don't begin to say, let's go and bring persons from elsewhere. Time will go and resources will be wasted and all of that. So equipment maintenance and care is very important, and you don't wait for it to break down. There's what is called planned preventive maintenance. So that should also be in place with experts who know how to keep this equipment, so that it's not by the in few years time we'll begin to have many of the equipment break down. And we should also not have this equipment packed in a store, because what we have many times, the equipment are procured, they are displayed to the media, TV, television, everybody is happy, but they are moved to the hospitals and locked up in a store because the government will not hire those who know how to use those equipment. For instance, you don't procure CT scan and you don't hire radiologists, who will be able to use it and interpret it. And you don't hire biomedical engineers who knows how to maintain it and ensure that it's running, So, and the generators, some of these equipment use, don't tolerate power failure and all of that, epileptic power supply. So congratulations. We hope to get those equipment soon. But very importantly, there should be a lot of transparency. I encourage, when these equipment are made available, please, the list of equipment per hospital should be made public, so that, for instance, there's general hospital in my community, Okposi General Hospital. I'm interested to know the equipment that is going there and ensure that they are used to the benefit of our people. In December 2020, the Ebonyi State government procured some equipment like beds, chairs, and other things for the general hospital. And it was when it was sent there, the MakeOurHospitalWork Campaign in Okposi went and took inventory of the equipment, so and was shared within the community. We were happy. In August 2021, I took a patient to the general hospital, and there was no good mattress for the patient to stay. And I asked questions, what's happening here? And it appeared that those equipment were packed in a store and they were not being used more than 8 months after. So if I didn't know that equipment were procured, I wouldn't have asked questions. And because of my questions and that of other persons in the community, because I had to raise alarm, other persons in the community started asking questions. The then Commissioner for Health had to go to the General Hospital the next day and directed that those equipment should be brought out to use. And as we asked why they're not using it, they said they've not gotten directive for it to be used. But some of them had gotten directive, gave themselves directive to borrow some of the equipment, whatever that meant, you know, out of the hospital. So it's important that the communities know that these are the equipment that are being supplied to each of the general hospitals, so that if they are not being put to use, we'll be able to ask questions. Then four specialist hospitals. Wow, sounds good, sounds good. But does Ebonyi State really need additional specialist hospitals at this time? The Dufut in Uburu, Hosa in Ebonyi South, is a specialist center, is a tertiary facility. It's new and is federal government owned and is growing. The AE Futa, the Federal University Teaching Hospital in Abakaliki, has been there for years, and also have a lot of specialists. The specialist hospital is in Ebonyi North. You know, if when the Ebonyi State University Teaching Hospital comes back on board, that will be three, and there's also a military specialist hospital that is, I don't know if it's been completed, that is being built in Abakaliki, around near Nkwego or so, thereabouts. So if that is complete, that would be like four. So four tertiary hospitals, in my thinking, is good enough for Ebonyi State. So it's not just how good it sounds to say you're building a specialist hospital. Specialist is not by name. Where is the need? So the ones we have, let's get them optimally functional. It's a referral hospital. So instead of building four specialist hospitals, use those resources to make primary health care work. There are at least one per ward. Ebonyi State has 171 wards. One per ward should be fully functional. Do you know that for a primary healthcare facility, you need as many as 35 staff? Yeah, 35 staff, at least 18 skilled staff, and 17 uh, 18 that will be, the skills are healthcare providers, and there are 17, other categories. So it's not just this one, two, three, five that, we don't even have up to five in any health center in Ebonyi, that are skilled health workers. So let's look at primary health centers. Primary health care can take care of at least 80% of our health needs if we have them fully functional. They would take up to 80%. General hospital could take, say, another 15%, so it's just 5% that is remaining for the tertiary hospitals. So if there is a place that more resources need to be spent, is the primary healthcare facilities. So, Mr. Governor, instead of four new specialist hospitals, please use those resources to make our primary healthcare work. And primary healthcare has two components. You have the facility, you have the community. So it's not just about the health center, there's a community component. Things that are required to make it work involves human beings, it involves a lot of training, involves a lot of supervision, it's a monitor and evaluation, and a whole lot of other things to make them work. If primary healthcare work, it's, there'll be more of disease prevention. We have less of treatment. So we should be looking at not just treating diseases, but also prevention, because prevention is cheaper and is also better, and it saves more lives than just focusing on curative. Mr. Governor, this is not free advice why they give you and your team. The health insurance is also very important. So some of this money invests in health insurance. Expand it if possible. If you can have every resident of Ebonyi State under health insurance cover, as provided by Section 14 of the National Health Insurance Authority Act, that would be wonderful. You would have, uh, left a very huge legacy and make Ebonyi an example. Because if you build specialist hospitals and people are unable to afford out-of-pocket expenditure, but it's one of the poorest states in Nigeria, and the poorest in the southern Nigeria, unfortunately. So health insurance is one of the major packages, so that the pressure will not be on the already poor citizens, to put deep money into their pockets to pay for healthcare. So do that instead of four specialist hospitals, expand health insurance coverage, and also invest in primary healthcare. The CT scan, MRI are good. Some of them can be in the general hospital. Yeah, you can be in the general hospital. You have in the teaching hospital, for instance, the Nkalago axis, you could have one general hospital there that could be very well equipped. Then perhaps some consultants, could be going there to provide emergency specialist services, and you have good ambulance system to move people. Why I mentioned Nkalago is the one in Uburu can serve the Horse axis, Ebonyi South, that's the Dufut, which is already very well equipped. Then there's a general hospital in Owuteda, Afikpo has Mata Hospital, it has another private hospital that is good, so they have some reasonable options in Afikpo. Eda might need, a hospital, a secondary health facility that is good enough, so general hospital, Owuteda could play that role. Then Onweke General Hospital, appears busy, and Onweke is also, very close to Abakaliki, like 20 minutes or thereabout, less than that. So then that's in Ishelu, Kalago specifically. So with that, we have, in each of the zones, good referral centers that we have good manpower, equipment, and all of that. So, in my opinion, we don't need new specialist hospital at the moment for the state government to build. Let's concentrate on getting the existing ones to work. And if there are people to let private sector players come and build and take advantage of health insurance and thrive. So number 6, 11 kVA generators. Yeah, it's good having the KVA generators, but I also recommend, because of our planet, for us to explore solar where possible, so except where solar will not be sufficient, because the cost of maintenance of some of these generators can be high, gas or fuel and other costs of maintenance. So, but the order has been made is good, but we can also explore clean energy in many other health facilities. So electricity supply in every healthcare facility is very important, just as water supply. So 7 day 52 ambulances paid for. Well, ambulance is good, procurement is good, but we should make it work. What political actors usually do, they just procure ambulances. Some health workers use it to go and carry tomato from Ogu leaf for family errands, or carry bags of rice during festive seasons. Absolutely unacceptable. There was keke ambulance procured. Sometimes they distributed it and they said they were using it for security and all of that. So this is not the first time ambulances will be procured in Ebonyi. The ambulance system, is something that's 247. People should have a number to call in medical emergencies, and there must be a nearby ambulance. The state might consider having a public-private partnership to manage these ambulances. Procurement is the easiest part, but making it work and using it to save lives is the other part. And this is something that should be ready to go at any time, and should be self-sustainable. So with health insurance and all of that, and also having good hands and good communication platform, good enough. The road system in Ebonyi is largely good. There are still very hard to reach places, so there have to be a way mapping all those very hard to reach places to connect to where the ambulance can easily go through. So there are human beings who work in the ambulance who will be resuscitating patients. Ambulances are not for carrying corpses. They are for carrying human beings and resuscitating them, saving their lives in the event of health emergencies. So the ambulance system has to be set up, and managed by people who know how to do that, to ensure that it's very useful. So the hiring of number 8 is the hiring of 36 medical officers. I think this is good. This is good. I felt very happy when that announcement was made, and I'm happy to know that hiring has been done, not just of doctors, but also medical laboratory scientists and also pharmacists as well. I hope nurses were also hired, because we need every cadre of healthcare workers. And going forward, we also look at the physiotherapists or medical rehabilitation personnel, radiographers, and other category of workers. This general hospital also need to have accountants, who will look in charge of finances, medical record officers. The health sector is a very large space, and everybody is needed because it's a teamwork. It's not just those who are providing the care. There are a lot of others who are uh, working behind the scene to make sure that the system is running. So motivating them with cars, fantastic. If uh, political appointees are getting brand new cars, then why not those who are helping to save lives? But let me also, I don't know if the governor also has a plan for other health workers. I believe everyone deserves the incentive. So while you're giving the SUV to the doctors, there should also be incentive to other health workers. So that's really very important. Then every medical officer having a brand new car is good. So I think I've covered all of this free advice, free technical advice. So to the governor, the commissioner for health, and the team, if you find it useful, good. If you don't find it useful, well, I've said my own from the professional perspective. We all want Ebonyi to work. We all want our hospitals to work. We all want our states to be healthy. So this humanity, this development. So not partisan politics. So let's all hands on deck. For the citizens, it's not just singing hallelujah. This is huge investment from our money, and we must shine our eyes to make sure that these investments are worth it and are working for us. So it's important that the state creates a feedback mechanism for citizens to give feedback on their experience in using this. Trust us, make our to work campaign. We go shine eyes, for all our members across the Ebonyi state, across everywhere, and we are going to be sensitizing people on what to do and questions to ask, to make sure that all this we get value for the money, not just for paparazzi or for clapping of hands, but for the benefits that Ebonyi people deserve, the full benefits. So happy 2024. We can't wait to see the primary healthcare, the general hospitals, the tertiary hospitals work optimally in Ebonyi State. Congratulations, the state, for now, because I've documented this. We'll be following up any good step that is taken. We applaud it. Any step that we feel that is not so good, we draw attention to it and we make our suggestions. If you not like, call me names. If you not like, I mean, say I no agree. Kwochiri, isi aboncha. I could talk about CB. I don't dey used to am, so, but I won't hesitate to say bravo on the side that's been done well and give my two kobo on how we could make sure that everything is going fine for the benefit of anyị niile. Ya gazie no, make our hospital work for everyone, everywhere in Nigeria. Play your part. Bye.